Hello everyone, my name is Karina Mercado and today I'll be talking about the opioid epidemic. So let's get started. Okay, so we'll start by talking about the origin of opioids. Opioids have a long history starting with the cultivation of the opioid poppy in ancient civilizations, which remains the source of natural opioids like morphine and codeine. These substances have been used for thousands of years to treat pain in patients. The earliest recorded use of opium comes from the Sumerians around 3400 BCE, where the opium poppy was cultivated and used for its pain-relieving properties. Other ancient civilizations, including the Egyptians, Greeks, and Romans, also used opium for medicinal purposes, often to treat pain or as a sedative. And in 1805, the German chemist Friedrich isolated morphine, the first alkaloid extracted from opium. This marked the beginning of the scientific development of opioids for pain relief, which eventually led to their widespread use in modern medicine. In the 20th century, researchers created semi-synthetic opioids like oxycodone and hydrocodone, which were designed to be stronger and long-lasting than natural morphine, making them popular for pain management but also increasing the potential for misuse. So now we'll go ahead and talk about the scope and the impact of the opioid epidemic. The opioid epidemic has reached critical levels with overdose deaths continuing to rise. In 2022, more than 80,000 people in the U.S. died from the opioid overdoses, with synthetic opioids making up 90% of those deaths. This marks a devastating trend that has persisted for years, with opioids, both prescription and illicit, being the primary drivers of these deaths. The epidemic's impact is widespread, affecting individuals from all socioeconomic backgrounds and all regions of the country, making it clear that this is a public health crisis, not limited to any one community. Fentanyl, a synthetic opioid, has significantly worsened the epidemic. Originally developed for medical use as a potent pain reliever for cancer patients, fentanyl is now one of the leading causes of opioid overdose deaths. What makes fentanyl particularly dangerous is its potency. It is estimated to be 50 to 100 times stronger than morphine and about 15 times stronger than heroin. Even small amounts of fentanyl can cause an overdose. Fentanyl is widely available because it is illegally made and sold, often mixed with other drugs like heroin, cocaine, and fake prescription pills. People using these drugs often don't even know they're getting fentanyl, which makes it hard for them to judge how strong the drugs are. This has led to a sharp rise in fatal overdoses. Fentanyl's presence in the illegal drug market has made the opioid epidemic worse and has made it harder to control the crisis. Okay, moving on. Okay, moving on to the widespread impact of the current opioid epidemic. So this epidemic has no boundaries, as I mentioned earlier. It affects people of all ages, races, and socioeconomic statuses. While the opioid crisis initially impacted specific demographics such as middle-aged white men in rural areas, it has since spread to urban and suburban areas and affected a broader range of ethnic groups. The impact of opioid addiction and overdose extends beyond individuals to families, communities, and the healthcare system. Children who lose parents to overdose, families dealing with addiction, and communities experience a loss of workforce productivity, all part of the far-reaching consequences. Rural areas have been hit particularly hard by the opioid epidemic, as these regions often lack access to treatment facilities and healthcare resources. However, cities have also seen sharp increases in the overdose deaths, particularly due to the proliferation of fentanyl. The availability of fentanyl has made even casual drug use more dangerous, as users unknowingly ingest this substance. Okay, now we'll move on to the response and ongoing challenges of this current opioid epidemic. So in response to the opioid epidemic, governments have implemented stricter regulations on prescription opioids, aiming to reduce overprescribing and misuse. In response to the opioid epidemic, governments have put in place stricter rules to control prescription opioids. The goal is to reduce overprescribing and prevent misuse. Doctors are now more careful when prescribing opioids, making sure they are only given when necessary. At the same time, there has been an increase in treatment options for those struggling with addiction. For example, naloxone is a medication that can quickly reverse an opioid overdose, and it's becoming more widely available. Another important option is medicated assisted treatment, which combines medications with counseling to help people recover from opioid addiction. MAT has been successful in helping many individuals lead healthier lives. However, despite these efforts, the epidemic is far from over. One major challenge is that access to treatment is still limited, particularly in rural areas where healthcare facilities are fewer. Additionally, the widespread availability of fentanyl has made prevention even harder. Fentanyl is far more potent than other opioids and is often mixed with other drugs, making it difficult, again, to predict how strong the drug is or how dangerous it is. Another ongoing issue is how to make sure people who need pain relief, especially those with legitimate conditions, can get the care they need without risking addiction. Balancing pain management with addiction prevention is a tricky challenge. Moving forward, continued efforts in prevention, providing better treatment options, and harm reduction strategies will be essential in addressing the opioid crisis effectively. So now we're going to go look at the factors that contribute to this opioid epidemic. So the first one will be the overprescription of opioids. It has been a major contributor to the opioid epidemic. In the past, doctors frequently prescribed large quantities of opioids like oxycodone and hydrocodone, even for conditions that could have been treated with alternative pain management methods. These medications were often prescribed for long-term pain, which led many patients to become physically dependent on them over time. As dependence grew, some individuals start misusing their prescriptions or sought out additional opioids from illicit sources, further fueling the crisis. Even when opioids are prescribed correctly for legitimate medical reasons, they can still lead to physical dependence and addiction. Over time, the body can build a tolerance to the drug, requiring higher doses to achieve the same effect, which increases the risk of misuse. As individuals become dependent on prescription opioids, some may begin to misuse them or continue using them beyond the prescribed period, leading to addiction and contributing to the larger opioid epidemic. And finally, the shift from prescription opioids to heroin and fentanyl has significantly contributed to the opioid epidemic, as individuals addicted to prescription painkillers often seek alternative sources when prescriptions are reduced or become harder to obtain. Heroin and fentanyl are more potent and accessible, leading to an increase in overdose deaths due to their high toxicity. So now we'll move on. Okay, so now we'll look at some more factors that are leading to this opioid epidemic. So the lack of effective pain management alternatives has played a significant role in the opioid epidemic. For many individuals, opioids became the default treatment for pain because they were often seen as the quickest and most effective solution, especially in cases of chronic pain. In many instances, healthcare providers relied on opioids due to the limited knowledge or access to non-addictive alternatives, such as physical therapy, acupuncture, cognitive behavior therapy, or non-opioid medications. Additionally, the pharmaceutical industry plays a role in the opioid epidemic by aggressively marketing opioids like oxycodone, often downplaying their addictive potential and promoting them as safe for long-term use. This marketing strategy led to widespread prescription of opioids, fueling addiction rates and creating a public health crisis. While legal settlements and increasing restrictions have led to tighter regulations, the long-lasting effects of these industry practices continue to affect the epidemic today. So now we'll get into whether or not there's an absence of Christian worldview in the U.S. healthcare system based on this opioid epidemic. So the U.S. healthcare system emphasizes on quick fixes and pharmaceutical solutions. This reflects a tendency to prioritize immediate symptom relief rather than addressing the deeper underlying cause of issues such as addiction. This approach often leads to overprescription of opioids and a reliance on medications to manage pain or addiction, without offering sufficient long-term strategies like therapy, counseling, or social support. Profit motives also play a significant role, as pharmaceutical companies and healthcare providers are incentivized to prescribe drugs that generate revenue, rather than focusing on holistic care that considers the patient's emotional, mental, or socioeconomic well-being. As a result, individuals struggling with addiction are often left without the comprehensive care they need, leading to a dangerous shift from prescription opioids to more accessible but far more harmful substances, such as heroin and fentanyl. This cycle shows the system's failure to provide compassionate and restorative care to patients. This does not align with the Christian worldview. Christianity teaches that each person is created in the image of God, deserves dignity, and we must protect and take care of God's creation. And by the system focusing on quick fixes and profit, it fails to honor this principle. So I included a Bible verse that I thought aligned with this absence of, or not absence, but of why we should care and how God sees healthcare providers in the healthcare system. And it's from Proverbs 3:27, and it says, "Do not withhold good from those to whom it is due when it is in your power to act." This passage just encourages individuals to act in kindness and to provide care when it is within their ability to do so. In the context of healthcare system, this reflects the responsibility to offer holistic care and support, especially for those struggling with addictions, instead of focusing solely on profit or quick fixes. It calls for compassion and responsibility in meeting the needs of others, which is often lacking in the system that prioritize pharmaceutical solutions over meaningful long-term recovery. Okay, so now we'll talk about some associated trends of the opioid epidemic. So the rise in neonatal abstinence syndrome, also known as NAS, is closely linked in the increasing use of opioids during pregnancy, which exposes unborn children to drugs and causes withdrawal symptoms after birth. Babies born with NAS often experience a range of complications, including seizures, difficulty feeding, respiratory problems, and irritability, which can result in longer hospital stays and higher medical costs. Additionally, these infants are at a greater risk for developmental delays and long-term health issues, creating a lifelong burden on healthcare systems and family as they require ongoing care and specialized treatment. With the increase in opioid overdose and addiction, we have also seen an increase in addiction treatment and harm reduction strategies. Medication-assisted treatment, using medications like methadone and I think it says buprenorphine, helps people reduce cravings and manage withdrawal symptoms, making it easier for them to stay in recovery. Naloxone, a drug that reverses opioid overdoses, has been widely distributed, saving many lives in emergency situations. In addition, needle exchange programs and safe spaces for consumptions help reduce health risks while combining mental health services with addiction. So how should we combat this opioid epidemic? So to combat the opioid epidemic, healthcare providers must be trained to prescribe opioids with greater caution. This includes considering non-addictive pain management options and consistently monitoring patients for signs of misuse. Public education campaigns are also essential to raise awareness about the dangers of opioids, signs of addiction, and the importance of seeking help early. Additionally, schools and communities should implement programs that focus on prevention, teaching individuals, especially young people, about the risk of opioid misuse before it starts. These steps will help reduce the prevalence of opioid use and provide early interventions to those at risk. Some additional resources for combating the opioid epidemic is prescription monitoring and regulation and support of families and communities. So strengthening prescription drug monitoring programs, PMPs, is essential for tracking opioid prescriptions and preventing misuse by allowing healthcare providers to access real-time data on a patient's prescription history. Enforcing regulations that limit the quantity and duration of opioid prescriptions can help prevent overprescribing, ensuring that opioids are only given when absolutely necessary. Additionally, these measures help limit doctor shopping, where individuals visit multiple doctors to obtain prescriptions for opioids, reducing the availability of opioids for non-medical use and decreasing the risk of addiction. Providing resources for families affected by addiction is crucial in combating the opioid epidemic, as it helps create a support system for those struggling with substance abuse. Support groups, counseling, and social services offer emotional support and practical guidance for both individuals in recovery and their families, fostering resilience and recovery. By addressing the broader impact of addiction on families and communities, these resources can help break the cycle of substance abuse, improving mental health outcomes, and provide the necessary tools for long-term healing and stability. Thank you so much for listening to my PowerPoint, and here are a list of references that I used for this PowerPoint. Thank you.